Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to the Whole Health Podcast. I am so excited to have a relatively new friend to me, Amber White, joining us today, partially because, she's part of my dental posse. She's a hygienist and holistic healthcare practitioner on the East Coast. So I'll share a little bit about her. Amber White is a registered dental hygienist and a holistic health practitioner specializing in biological and whole body dentistry. Her work focuses on the oral systemic connection, mineral balance, nervous system regulation, hormonal health, and support for the oral microbiome, helping both patients and practitioners understand how oral health influences the entire body. Amber is the founder of Beyond the Mouth and Beyond Dentistry Collective, where she mentors dental professionals worldwide on integrating whole body dentistry into clinical care, patient experience, and practice structure. With a background spanning clinical dentistry, wellness coaching, and practice growth, she brings a rare ability to connect science, systems, and sustainability in modern dental care. Thank you for that, Amber. Her mission is to help practitioners move beyond symptom-based dentistry and build practices that support long-term health, deeper patient trust, and practitioner longevity. Thank you for joining us today.
Thank you so much for having me. I'm so excited to be here.
This is, I feel like I want to say you're singing my song. Mm-hmm. This is so refreshing to hear. Megan and I came together kind of as a result of two healthcare providers on different avenues, our paths crossed. And I think that what you are focusing on in terms of not just the practitioner longevity, which I love, but the whole body connection is so, I'm going to use the N word, needed.
Oh.
I know, I don't use that one lightly. Truly, for the sake of the health of the world's population, appreciating that what happens in the mouth impacts the body. So I'd love to start off by asking, you went to hygiene school, then what happened?
Yeah, so, I actually went to hygiene school a little bit later. I started with a psychology degree right out of high school, and honestly, the degree I never used, but I use every day, right? And something in me always wanted to work with people on their health. In hygiene, I felt connected to like that one-on-one component and really building relationships with my patients. And I think that's what really drew me in initially to the field.
Something you two have in common.
Yeah, I love it. Yeah, it's my degree is also in psychology, and I remember thinking going through dental school, like, well, how's this going to apply? And it turns out every single day, we are working with human beings after all. So you got into, did you go straight into practice, like clinical care?
I did, yeah. I went right into practice. I worked at different specialty offices, periodontal offices, general practice. And I was working more in that conventional, traditional model of dentistry for about 3 years. Mm-hmm. And I really just started to notice patterns with my patients, right? The ones that weren't healing, the ones that were doing everything right. Or you might see the patient who hadn't been in to have a dental visit in years and years, but everything looked perfect, right? Mm-hmm. And so there were so many things that my education couldn't explain. And I've always been one to ask questions and want to dive deeper. And so to me, that was eye-opening. And I felt like there had to be more that I could do for my patients.
Mm-hmm.
What were some of those patterns that started to stand out to you and make you think there's got to be something going on here that we're missing?
Yeah, I would see patients that had great hygiene or that we had gone through periodontal therapy with who still had this like chronic inflammation or bleeding response that really didn't tie into their home care. And I think in hygiene, we're so driven to recommend the products and the brushing and the flossing, but we weren't necessarily thinking about the other systems of the body and how they were connected. And I feel like in a more traditional model where we're watching a lot and we're waiting, right? It's like, watch this tooth and watch this tissue. And if they don't hit a certain criteria, we're not able to do more advanced treatment for them, right? Based on the insurance model. And so to me, that just never sat well with me.
And for the sake of those who may not have considered it before, when you say the insurance model, would you clarify what that looks like through your lens?
Yeah, I mean, the insurance model, to me, in my my view, is that it doesn't have the patient, the individual in mind. It's really a blanket assessment that doesn't take in any of the individual uniqueness of each patient. And so, for an example, in hygiene, we're working with gum disease and periodontal disease, and there are certain criteria that patients need to fall under before they qualify to have periodontal therapy. But they could still have this chronic low-grade inflammation, bleeding response, unhealthy tissue for years before they ever fall into that criteria. So insurance is never going to cover more advanced treatment if we don't get past to a more disease process state.
So like in the medical non-dental field, very similarly, we're waiting for the diagnosis to do anything about it versus seeing the early signs and then working on prevention. And we can do that. We just struggle to do that with insurance coverage.
Exactly.
So then after you're seeing these patterns and you're seeing that you're not able to get in at the timeline that would be most effective for the patient in early prevention, what did you see the limitations were to your role at that time with going deeper into the patient's whole body health?
I felt like there were a lot, of course, time constraints and having the time to actually educate our patients because, in a hygiene schedule, you're moving from one patient to the next pretty quickly. Also, I think I just didn't have all of the knowledge and tools to be able to start to connect the dots for my patients, right? I had what I learned in school and I had my continuing education courses, but I didn't necessarily have all of the knowledge that I have today where I can actually start to understand the root cause, connect the dots for my patients. So I think it wasn't until I had more advanced education and training that I was able to do that.
I'm wondering, is there a part of your story where something happened or changed where you decided, okay, I'm ready to dive deeper, and what was that, and what did it look like in terms of your journey from there?
Yeah, so I knew there had to be something else, but I really didn't know what it was. I didn't know the term biological dentistry, but in my head, I was envisioning what it could be, right? And so as far as continuing education, I started diving into nutrition because that was the thing I knew that I had researched for myself, and I knew I could help my patients understand that connected to their oral health. I kind of had gotten to a point in the practice I was working in where I was feeling burnt out. I was feeling pressure to really just produce, right? and get patients in and out of the chair. And to be honest, almost overnight, I went from working in a traditional practice as a hygienist to managing a startup biological and dental practice in my town.
Wow.
And so that was a huge paradigm shift. And it really just happened so organically and so quickly once my wheels started turning. And so I just was thrown into it and just wanted to soak up every bit of knowledge I could.
So you got to put it in real practice real quick.
Very quickly.
Okay.
Was that the project that Jerry started?
Yes.
Yeah.
So
Okay.
Joel was my first mentor. It was him and I. And so that was my first entry point into biological dentistry. And then I just started taking multiple courses, just wanting to know everything and having some incredible mentors along the way.
That's awesome. Yeah, he's a great guy. Well, you said something just a minute ago about feeling like you needed to produce. And I want to touch on that because I think most people who listen to this have experienced, I'm going in to see my dentist today, get my teeth cleaned. as the provider of those services for a number of years, what do you mean by you were kind of driven for production?
Yeah, so this has happened to a lot of practices where these general practices, privately owned practices, get bought out by corporations, right? And there's productivity goals and there's, compensation based on recommendations that you provide. And some of those recommendations that I was being guided to share with my patients didn't align with what I thought they needed. And so there was always, these quotas that they wanted you to fulfill. But to me, that just never felt right with someone's health, right? I mean, I think there's so many different things that we can recommend, but things that didn't fully align with my mindset or what I thought my patients needed was just something that I just couldn't get past.
Yeah. And what might be an example of a quota? Because I can't relate to that at all, but as a provider of personalized health services,
Right.
meeting a quota just sounds crazy. But what would be an example of that?
An example, fluoride treatment, right? That was something that if you recommended fluoride treatment for all of your patients, you would get a percentage back for providing that for your patients. There's a material for periodontal patients called Arestin. Can I say the names of products?
Sure.
It's not a product that I feel confident that is making a major change for my patients. And that was something that was also, compensated. So there were different things that, and at the time, I had started to do my own research on fluoride, right? When I first got out of school, I thought this was like the miracle, right? And then I started to learn more before I even got into biological dentistry and understanding that it's a neurotoxin and understanding it's not the right treatment for everybody. So I couldn't justify what I knew and then recommending that to a patient who I knew it wasn't right for.
Yeah. Well, and that having that knowledge helps a patient understand the intrinsic motivation coming from their providers, right? And also, I actually think it empowers them because they know, okay, there may be this intrinsic motivation, but I still have choice. I can still have choice. I don't think most patients know that there is a background incentive financially to healthcare providers at large, which because of these larger corporations that have bought up medical and dental practices, that the decisions are being made to fill these quotas and not necessarily for their individualized care. And it ignores the root cause, right? Fluoride doesn't fix a root cause.
Exactly.
Well, and I'm glad that you're bringing up that particularly as it pertains to fluoride usage. For sure, you apply fluoride in the way we're taught to do it, and it makes an enamel surface more acid resistant. That's scientific fact. But how often when you were, making recommendations to the patients, hey, I'd suggest we get these fluorides straight, were they asking you to also share with them, by the way, your mucosa will absorb this, and which presents neurological risk, just so you're well informed, because, informed consent is highly important. I imagine that had nothing to do with the quotas and such.
Yeah, that wasn't part of the conversation that was recommended.
Yeah, also tell them why not to do it, right? Oh, my gosh. So, I don't want to interrupt
No,
Megan.
go. I'll jump in when I'm ready.
Okay, fair enough. So you went to the new practice, and what I want to know, because you guys were starting from scratch. I know a number of the people who've worked there over the years, and what was that like? What were some of the biggest challenges, or maybe the biggest ahas or takeaways from building this thing from scratch, which is so different from the traditional dental practice?
Yeah, there's so much, right? When I walked in there, we had equipment and materials, and that was it, right? We had the rooms, we had the space, and I had to help set it all up. So there was a lot that came with just the structure of setting up a practice. And I think the biggest thing was really getting to understand, right, the whole body approach to dentistry. And it was new to me, although it was something that I was kind of moving towards, there was still so much more to learn. And within that practice, it wasn't just dental, right? There was a whole bioregulatory medical side of care. And so it was very quickly on that it was combining dental treatment with medical care, right? Involving the body in healing. And so that was probably one of the most powerful takeaways, is that there's so much more that we can offer to our patients and so much more that we can do to support healing. And a lot of those therapies, they're going to support us nutritionally through IVs. They're going to support our detox and drainage pathways, but they're ultimately going to support our nervous system regulation and getting in that state, that parasympathetic state, to heal.
So I know if I were a patient listening to you, I'd be thinking like, yeah, I want you to be thinking about all of that for me. Thank you for taking that responsibility to think about how I can heal optimally, even if it's new information, because I know we're all kind of used to going to the dentist and just having them look at our teeth, right? But it seems like this is a sell to a patient where you can say, hey, would you like me to think about your whole body as we go through this process? And they're probably going to say yes. But I'm interested in also the aspect of what you do where you're trying to, I don't want to say sell, but you're trying to expose providers to this, because to me, that's where I see so much resistance. I see patients want care, but providers that are indoctrinated into a specialty where they only look at one system in the body instead of systems biology. How is that conversation had with providers that are still in an old model?
I think it is one that takes time and can be difficult to break. I mean, I'm in Rhode Island, and I think at the time, this whole experience was almost 10 years ago now, 8 years ago or so. And I think we've moved a little bit since then in my area, but it's still an area that's very resistant to change and more resistant to this whole body approach. So I think it is having conversations and asking questions. And I think some of the biggest takeaways for those providers who tend to be more resistant is hearing it from their patients and learning from their patients. Mm-hmm. I think I've talked to many, more conventional dentists in my area, and they reach out to me because their patients are asking for it, but they're not ready to make that full shift into a biological model. But the patients are ready.
Okay. Interesting.
Yeah, I think you bring up a good point that it seems to me like in the past 5 years, which kind of, is synergistic to our relationship, the awareness, like 10 years ago when I became aware of this holistic and biological approach, which was through patients asking me, they were asking about like things like cavitation, ceramic implants, and I'm like, I've never heard of these things. And so, to your point, the grassroots efforts of sharing these things on podcasts like this absolutely work. And it only makes good sense when a person, let's say, they're having jawbone cleaned up or they're having, infected root canals removed. It's not a passive experience. I mean, their body then has to go through a very significant healing process. I love that in your practice, you're able to think about and, put into function thinking about your nutrition, thinking about your gut absorption, thinking about your detoxification pathways, thinking about your mindset. Mm-hmm. Because, having learned through the school of hard knocks myself, I see like that's where the rubber meets the road when somebody's well prepared, not just, physiologically, but emotionally as well. It makes such a difference. So thank you for all that you're doing to get this information out there. I'm curious to know. Did you have something? I saw you had something.
I do.
Go ahead. Go ahead.
Okay. Well, I was going to say, I'm curious to know. I'm curious to know. What does it look like in a daily practice to take on that responsibility of educating your patients around their nutrition, lifestyle, nervous system? How do you even tackle that? And what is different about that patient experience, like time and interaction with the staff?
Yeah. So in that type of clinical setting, things slow down, right? And we're taking more time to actively listen to our patients, right? even before they get in the door, their intake, right? So when I was managing that practice, I was taking all of the new patient calls. So I would get a part of their story right out of the gate. We're getting a more detailed medical history, a timeline of when things shifted in their health, especially those that are coming to us with chronic illness. And then we're starting to have conversations differently. We're starting to really hear the patient, really listen to what they're saying, because I think that's something that's so missed. And then it really is asking for permission to share more, right? How everything is connected, how, our mouth is the entry point, the gateway to our body, right? It also shows us so much of what's happening inside. And it's like, how can we bring your health to an optimal level? Most people don't even know what optimal health feels like because they've never experienced it. And so it's hard for them to even strive for that, right? But I think it is involving them in their care, making sure they feel like they're an active participant, and helping to advocate for them to feel their best.
How much time are you spending with patients?
In that setting, it was a 2-hour visit, probably about an hour of that, just talking outside of the dental chair, getting to know their story, their history, their goals, and then taking all of, the diagnostics and all of that.
Is it essential in that type of a practice model to have coaching? So what type of follow through and support do you provide when you can say like, hey, you need to do this. This will change your health. But then how do you help the patient move along in those new habits?
I think it is. I think health coaching is a huge part of it. And that's actually more of what I do today. I don't necessarily work as much clinically as I used to. But I think being able to support the patients through their journey, I think, especially when we're seeing patients, right, like Dr. Blodgett, you're seeing cavitation surgeries and smart removals and all of these things that require so much pre and post-treatment care. And it's really creating the plans around that and being able to support them through that cycle of treatment, right? We're all making treatment plans and then phasing them out. So having that guided support throughout their treatment plan is really important.
Yeah.
I'm wondering why she doesn't move to Portland and come work with me.
Is this a job offer?
I'm just like, wow, the synergy is unbelievable.
You've been proposed to.
Yeah. We make a good team around here. I'm curious, because I know you're doing coaching with a lot of dental teams, right?
Yes.
So what are the commonalities of I'm assuming it's dentists generally speaking. What's the commonalities of their stories when they're reaching out to you and saying, hey, we'd like help building such and such? What's that about?
I think so many of them have gone on their own health journey. That's something I hear of a lot, where they've actually started seeing functional medicine or taking a different approach to their health and wanting to bring it into their practice, but not knowing where to begin. There's so many different ways to begin in a more holistic or biological approach, right? I think there's things that we could incorporate into practice tomorrow if we were ready to make a change, but some other things are going to take more time to gain the knowledge and the nuance of everything. But I think it's that they're on their own journey and they've changed the way they're viewing their health and that of their families. I also think it's patients asking more questions. I know there's organizations that, support biological and holistic dentistry, but I think it's harder to find when you don't know what you're looking for. So I think a lot of people have found me through other, social media platforms or referrals from other providers that I've connected with.
That's awesome.
Yeah. What is that process like for a provider when they come to you and they say, okay, I know something needs to change? What happens?
Yeah. So about 6 months ago or so, I started a course called Beyond the Mouth, and it is an 8-week course that is kind of like a deep dive into biological dentistry, and it really is like a good starting point to start to look at your patients differently, see them differently, and be able to treat them differently, right? And so it goes into what whole body dentistry really is, that oral systemic connection. We get into the oral terrain, minerals, nervous system, gut health, and how to actually apply it in a clinical setting. And so that is typically now where I have people start, because I think it can get them like a good foundation for how to move forward.
Yeah.
And then I also do work with people one-on-one as they're integrating and getting their team on board, because there's so much that comes with that too, right? When we start to have that paradigm shift ourselves and also like have a new vision and a new mission for our practice, like getting the team on board, they really have to understand that and feel that too.
Is that a moment in time where you see the staff, the hygienists, the admin staff, everybody all of a sudden hold up a mirror and say, oh, okay, hold on. It's whole body health.
Yeah. I feel like for the most part, the teams get so excited, right?
That's
Because
awesome.
I think the one thing that is such a shift when you get into this more whole body approach is like you can go from being the burnt out dental professional, which so many are, right, to having like this new passion, this like reinvigoration of how we're doing this work, right? And it honestly, like to me, one of the most exciting things is always connecting the dots and getting to the root cause. Like I love investigating and I love diving deeper. And I think that's fun for a lot of people, right? It changes the day to day. It's not the same thing over and over again.
Absolutely.
Yeah, it's funny. In my visual brain here, when I'm imagining, like imagine you're graduating from dental hygiene school, and the bar to get over to feel excited and satisfied is like, ooh, it's a clean root surface. There was tartar, and now it's completely clean, and I'm just going to go home and feel so excited. And 2 years later, after having done that thousands of times, you're like, oh, okay, is there more to this? And I certainly applaud you for jumping out of the frying pan and into the fire, starting with that practice and opening yourself to how much there is to learn and grow, and to be such a significant part of helping dental providers see that there's this whole world of possibility. And the polar opposite to that squeaky clean root is lives transformed. People who are bedridden or using walkers or, feeling sick and tired every day to having thriving lives, which I suspect you have observed numerous times now.
Absolutely.
That is such a different degree of value. And I think that one thing you mentioned earlier was this time issue.
Yeah.
I mean, I know that something that sounds like the three of us share is the amount of time taken to really get to know that human being, particularly on their first visit, because there is an entire life story there. They usually go from 2 hours at my office to probably 2 hours with Megan to understand even more.
We're best friends by the end of it.
Yeah.
Yeah.
And we do see lives transformed, which is so great. So you mentioned how people are finding you. How much, I'm curious, like you're one human being, how many providers are you hoping to find or coach or lead or mentor in your journey?
I feel like honestly, as many as I can, right? As much as my capacity will allow. What I'm having now is more of these group containers and really building a community, which has been incredible. I mean, 70 people have gone through this course in the past 6 months from all over the world,
Wow.
from
Wow.
15 different countries. And it's amazing to see countries that I've never been to, I've never thought about, who are just so open, and they are really leading the forefront in their area of the world. And so that to me is just like the most incredible thing. I'm the most grateful for it. I'm the most honored to be a part of it. And to me, that is just like means everything.
Congratulations.
Yeah. That's a really big deal. Big reach.
And I can't imagine how much time and energy it took to create what you created.
Yeah, it was definitely a passion project that is something that has been, I've wanted to create for a long time. But I mean, to be honest, right, we all have these mindset blocks and things that come up when we want to put something out into the world that doesn't exist. And so there was a while that I wanted to create this, but I was resistant. And this past year, I feel like I just knew it had to be put out into the world, and I did it in just like the most intentional way. And yeah, I just think it's been incredible.
That's amazing.
You use the word resistant, and I've been thinking about the process, sort of the process of a patient interacting with a biological dentist, the hygienist, thinking about their bodies differently, all of a sudden having their view of their health opened by you or somebody that's been trained by you or a different team practicing this way. And I am curious about one other aspect of how you navigate this world, which is when you identify that there may be something going on in the root cause with a patient, how do you support and advocate for them when then they have to turn around and go back to possibly their conventionally trained medical doctor or primary care doctor, and they need another level of care? Do you run into that as a point of resistance? Do you have a process for supporting them in that way?
Yeah, I mean, I definitely think, right, we know like this traditional models of healthcare, there is resistance to what we're offering to patients. There's definitely cases where, I'm referring back, and I think collaboration and interdisciplinary care is essential, right? I'm never going to be the only person helping my patient with their health or my client with their health. But I think it is giving them the language to advocate for themselves, giving them the information, right? Really empowering them to feel like they can actually change their health and they can speak up for themselves. Because I think the biggest thing we can do is be advocates for ourselves, or we're never going to actually achieve the health that we are looking for.
Absolutely. Yeah, that's great.
So as you are, because we know there are so many dental professionals out there burnt out. And I think it's also factual that, as a result of the COVID experience, that there were a lot, particularly in the hygiene world, there were so many providers who hung up their scalers. So now you have fewer people having to do more work. They're frustrated, they're tired, they're exhausted. What is your advice to them?
My advice to them is to find their passion, right? Find what lights them up and makes them most excited to get through their workday. I think in my programs, like I've mentored a lot of dentists, but I also have worked with a lot of hygienists who are opening their own practices, which I think is an incredible thing. But also I've worked with hygienists who are working in practices, they felt burnt out, and then they got into a more holistic or biological practice, and they are like reignited, right? So it's really finding the right people, the right office, the right space, right? A lot of times we can get complacent and stay in the same place because out of comfort, right? But I'm always one that's like, get out of your comfort zone and grow.
Yeah.
Beautiful. Yeah, it's true that the learning zone is well outside the comfort zone.
Yeah.
You have to be willing to get uncomfortable to continue growing. So it's awesome.
It is awesome. It is awesome. I think so much of the time, because we see burnout across the board in medicine, there is that feeling of wanting to just stop doing the job altogether, right? So many of my doctor friends are like, I just want to farm. I just want to, play an instrument. I'm like, I really have a lot of school just to farm. But, it's learning from what doesn't work for you in your, your sense of virtue and your own passion, and not being discouraged by that, but taking that as your sign that something just needs to change. And I think it's liberating for so many of us that want to do things differently.
I think it's also worth stating that change doesn't have to happen like instantaneously. You leave on Thursday or Friday and you walk in Monday and it's an entirely new practice. I mean, which is kind of what you experienced, Amber. Like,
Yes.
I was cleaning teeth one day and then boom, I'm managing a biological dental practice. I think like in my practice, change has occurred, almost all of it, just one tiny step at a time. One tiny step at a time. And I think it's okay to recognize, like, maybe instead of having incentive quotas for fluoride trays, we enact an education campaign to inform people about what does this actually mean? What are the pros? What are the cons? Is it appropriate for you? That might be step one. Maybe putting a water filter in your practice might be step two. I mean, I don't know. It could be anything. Doesn't mean you have to do it all at once, because I have seen on the flip side, I've met a number of providers who the fire gets lit and they feel so inspired that they're trying to take on 200 hours of continuing education in a single year. And by the end of it, they're almost dead, For that, let's say you do have the super energizer bunny practitioner reach out to you. Where are you generally suggesting they start that journey of change?
I think that there's so many things that we can do, and I completely agree with you with sometimes we try to do too much at once, right? Like where I landed was everything at your fingertips, right? But I think starting slow, like you mentioned, and really starting to implement some really simple things. I think as a hygienist, I think a hygiene room is like a perfect place to start implementing some things, right? Whether that be saliva testing or testing the pH or having a microscope, having these different conversations, because, the hygienist is seeing the patient more frequently. And they might have a stronger relationship because maybe they've been seeing the same patient for 10 years, right? So that's the perfect place to start, in my opinion. I also think it really starts from the front desk as well. Really starting to educate patients differently from the first phone call, from their welcome emails you send, from the intake forms you provide, because most people are used to filling out the standard intake form, right? And so I think even just filling it out and seeing the different questions you're asking, the different things you want to know about them, is just going to let them know that you're looking at things differently. So those would probably be like the first places I would start.
Mm-hmm. Well, and I want to acknowledge the power of what you just said, that seeing value in the role of every person in a healthcare practice is imperative, not only to help serve patients better, but to have better retention of teams. I mean, I think I'm on base here. I feel like my team is like, they're on fire for working at Blodgett Dental Care because every person there, I invest in all of them. Because they all play uniquely important and different roles. So I love that you're bringing that into your coaching. It's awesome. We're going to have some more talks offline here, I can tell.
Yes.
So one of the things that we always like to ask our guests, I hope you've been teed up for this because sometimes it can be
I think I did.
a shocking question to have to culminate all of the things into a statement. But what does whole health mean for you?
Whole health to me is a journey, right? There's no destination point in whole health. I think for me, this past year, I think I've been more focused on health than ever. Not just physically, but emotionally, mentally, spiritually. I think we have to understand that our health really is affected by every single thing we surround ourselves with, right? What we're doing, the habits we create, the people that we're around. I think being around people that uplift you, inspire you, make you a better person is one of the best things we can do for our health. I also think just getting so clear on what you believe in and your values, and really understanding that our bodies are so smart, right? And they have this innate ability to heal when we give them all the things they need to do so. So, the right nutrition, the right, maybe targeted supplements, the right lifestyle, the right habits. I just think it really is like bringing all the pieces together.
I love that.
Well, thank you so much for joining us on the Whole Health Podcast, Amber. You are a bright, shining light, and I love what you're doing in the field of particularly biological dentistry. I mean, the time is right, and kudos to you for, putting the energy in. Because as you said, you kind of put it off for a while, and they're like, I'm doing this. And I just applaud you. I think it's wonderful. And I know our paths are going to, probably all three of our paths are going to cross, significantly in the future. So thank you for your time and your energy and insights.
Thank you so much for having me.
Amber, tell everybody once again, what's the best way to find you?
Yeah, so my website is naturallyamberwhite.com. I am on Instagram at naturallyamberwhite. email info@naturallyamberwhite. It's all really simple.
Great. Well, thank you for being here. It was wonderful to meet you.
Thank you so much.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.